Welcome everyone, and thank you for joining our webinar today on developing population health analytic leaders and applied interdisciplinary approach. It is my pleasure to introduce you to our today's presenters, who are two very accomplished women in healthcare. First, we have Martha Sylvia, who is a PhD, MBA, and RN, who is president of Forest View Healthcare Solutions. She is also an associate professor at the Medical University of South Carolina College of Nursing, and she was previously director of population health analytics at the Medical University of South Carolina and at Johns Hopkins Healthcare. Secondly, we have an equally impressive person, Ines Maria Vigil, who is an MD, MPH, and MBA. She's currently the medical lead of Payer Provider Solutions at Clarify Health. She has over 16 years of leadership experience in healthcare and population health, and she previously served as the Vice President of Advanced Analytics and Population Health at Priority Health. And with that, I'd like to turn things over to Ines to go over to the objectives for today's webinar. Ines?
Thank you, Suzanne, and thank you to everyone who took the time to be here with us today. We, Dr. Sylvia and I, are very excited to go through this content with you, and we hope it'll prove as much value to you as we know it has to us over the years. So this session is essentially designed for academic program leaders, such as yourselves, and educators who design curriculum or courses or teach in any of the healthcare disciplines. At the end of this session, participants will be able to achieve the objectives that you see on the slide. It's important to note that this particular approach is meant to prepare a workforce in the practical application of population health analytics. Other approaches exist to support research, academics, and the creation of new science in the field of population health and analytics. And we're excited to kind of bring you the more practical application after years of service and seeing this being applied in real world settings. We have learned a thing or two, and we're super excited to share that with you today. Within the last 5 years, spreading infectious diseases like COVID and SARS have brought forward a whole new way of thinking about the way healthcare is valued, the way it's accessed, and the way it's delivered. Additionally, new and disruptive healthcare payment and delivery models have brought to the forefront the importance of the disciplines of epidemiology, biostatistics, and data science, both to healthcare management through value-based and population health initiatives. Now more than ever, healthcare is in need of a trained workforce that understands the transformation that's underway in healthcare and possesses the skills to deliver more high-value, affordable, and high-quality healthcare in the US and globally. One of the most important aspects of population health is the population health triad of understanding the health of the population, the experience of care, and the per capita cost. In this, you see the definition of population health as the distribution of health outcomes within a population, the health determinants that influence this distribution, and the policies and interventions that affect those determinants. So we'll be talking mostly within this context today. We have a poll question for you.
Yes.
This is meant to be interactive. So please, for all of you that are participating, please do fill in to see. You should see a poll question come up. You should be able to pick one or more of the selected answers. For this one, population health and public health are terms that are fairly interchangeable in as far as the process of analytics that are used. Do you agree, disagree, or are you not sure?
Okay, I'm going to close the poll out. It looks like right now 11% agree, 71% disagree, and 18% are not sure.
Great. Well, we're ecstatic. And I think we specifically asked this question because it's very challenging to know which one is to use at which time and for what purpose. And we asked the question because a lot of what population health, the underpinnings of population health, are drawn from the disciplines of epidemiology, biostatistics. A lot of the rigor and the methodologies that are used come from public health and the science of public health. When applying them in a more practical way to population health, we're working in a dynamic population, and that dynamic population comes and goes. And Dr. Sylvia has a really great example of this that she'll share with us today.
Great. So, hi, thank you for having me. And I'm super happy to be here to talk to you about my favorite topic, which is population health analytics. So to expand upon what Ines was saying about that question, the reason that we like it is that sometimes those in public health or health promotion sometimes feel that population health is just simply a renaming of really what has been their work and legacy. Population health really is a new and emerging discipline. It focuses on the intersection between many fields, including public health, medical and clinical care, economics, healthcare administration, biostatistics, environmental science, and more. And the idea is that it's not one of these in isolation, but it's the coming together of these disciplines that make population health its own unique discipline. There are differences between public health and population health in the way that populations are defined, the health determinants that might be addressed in public health versus population health. For instance, public health doesn't typically address healthcare system factors and medical care factors. So sequelae of chronic conditions, and maybe more recently, individually linked social determinants of health, such as income and education. And so you can see that all of these disciplines enhance and make what is population health. What positions population health as a solution to the way healthcare is delivered, and what positions value-based care as a solution to the way healthcare spend is managed, is actually this intersection of these multiple disciplines that you see here. So whereas multiple definitions and conceptual frameworks for population health exist, the definition that you see here on the left of the slide is new. And we've proposed this definition to the field, and it calls out the need for a unique set of skills that are required to transform data into meaningful, actionable, and effective business and clinical insights that improve health, reduce unwarranted costs, and improve the healthcare experience for everyone. And I'm sure you can read this here, but at its very core, speaking to the figure on the right, population health analytics requires, I'll emphasize, identifiable data, person-centric data points representing health determinants and health outcomes that are measured at regularly occurring time intervals. These are key components of population health analytics. And we refer to this as the population health data model on the right-hand side. And it's key to success for healthcare organizations to improve health outcomes using a person-centric population approach. So next, I think we have another poll question. Is that correct?
Yes. We do.
Great. So I'll just read the question is, what do you think are some of the toughest problems to solve for in the practice of population health analytics today? And then following this poll, Ines is going to talk through some of that with your responses.
Okay, looking at the data, it looks like 26% say data availability, 26% data integrity, 6% workflow tools and technology, 31% organizational culture alignment, and 9% data-driven decision-making. So I'm going to close out the poll.
Yeah, I think your responses are very interesting to us, and I think you all are spot on. As you can see in this slide, the bulk of the dollars in healthcare that have been spent on healthcare analytics in the US is expected by 2025 to be $21 billion. And so you're absolutely right. And that's solving for those challenges of data availability and data integrity. And so a lot of money has been spent in those areas. About 86% of providers are currently using an EHR, so workflow tools that help organizations employ data analytics, and more tracking of patients and patients' outcomes is available. Despite 90% of IT and analytics budgets being directed to maintaining tools and technology, not as much has gone into really addressing the culture, people, and processes aspect of it. What we see here is that 93% of the obstacles to the adoption of analytics are actually related to the culture, people, and processes within an organization, and they result in over $1,000 to $50,000 per person per year in lost potential cost savings opportunities. And that's really because of the bench strength or the lack thereof in analytic, clinical, and business teams working in a seamless way together to solve and tackle some of the most challenging healthcare problems today. So there's still a lot of room to improve in this area. And I think one of the most important imperatives that we can really describe for this is that population health is really being regarded as a solution to the fragmented healthcare system in the US today. Its valuation is expected to reach $62.2 billion by the year 2027, which is astounding. And this is going to create a huge workforce demand for clinicians, analysts, and business leaders alike. These leaders will need to be trained in the practical application of population health management and analytics. And we're super excited to kind of bring forward our experience on how we've been successful at doing that. I'm going to turn it over to Dr. Sylvia, who's going to actually walk us through a process that can be applied in your coursework to really mimic a real world scenario for staff working in population health analytics today and in the future.
So as Ines and I have been working in this field, we struggled to find frameworks that could actually guide us in the work that we do in healthcare organizations today that really fit a process that you need to follow to be able to organize yourself around doing the work of population health. So this is an approach that you can take in coursework to methodically progress through the population health process. This may seem familiar to you based on what discipline you come from. For example, for those of you who might be in nursing professions, you may see the resemblance to the nursing process. Similarly, for other clinical care sciences, you can probably relate this process to what you learned in your clinical sciences. You might also see the similarities to an evidence-based practice process. So many of us that work in healthcare are used to following some type of process. So this is a process that you can follow for population health management and design your coursework and curriculum around. If you want to go to the next slide. Population health is driven by analytics, and there are a key set of analytic outputs that are needed for each step of this process. So each of these analytic outputs draws on analytic methods from biostatistics, epidemiology, finance, actuarial, quality improvement methods, and more. So you can see here that the way that we organize ourselves around this process and analytics is we understand those key analytic products that are needed in each step of the process. And then we can guide organizations to be able to execute and be successful and have successful outcomes. So next I'm going to turn it over to Ines, who's going to talk about the interdisciplinary teamwork that it takes to execute in population health analytics.
So this slide is a really fun way to introduce you to the multidisciplinary, what we're calling the PopHealth Troika. Troika is a word that originates from Czech and Russian origin for three mighty horses, all pulling the sled together, all pointed in the same direction, and all working to achieve the same goal. We define the PopHealth Troika as a team made up of an analyst, a clinician, and a business lead. With over 35 years of combined practical population health experience, Dr. Sylvia and I have discovered the multi and interdisciplinary approach to be the most effective at achieving the results of population health and achieving wins at value-based care. And actually, if you think about it, working in teams increases collaboration and brainstorming. Two or more people are always better than one for solving problems, finishing off difficult tasks, and also increasing each other's creativity. And really, everyone is unique and has different skills, backgrounds, and experiences. So it's really important to assist your students to recognize their respective skills in each of these leadership roles, and also to recognize their limitations of their knowledge base and their experiences, so that they may actually be able to identify when to seek out other individuals with those strengths in the areas of their relative weakness to strengthen the work product overall. We also want to encourage teamwork and communication between team members, and that's not always assumed in the workplace. In the workplace, it's very easy to become isolated and try to do things yourself. And what we've learned is we want to be able to encourage that team-based approach. Thank you, Suzanne. So developing the analyst competencies. So many of the skills we see in analysts coming out of training are really focused on the technical skills of data management, reporting, statistics, visualization. We implore additional skills to be fostered, such as understanding the business of the way healthcare is delivered and paid for, and the workflows that really underlie the behaviors of hospitals, clinicians, offices, and insurance companies. The ethical uncertainty that can arise in assigning a patient a certain characteristic based upon finding a pattern in the data, such as non-compliant or high risk or high cost. Those all have consequences. And of course, the interpersonal skills of communication, critical thinking, and problem solving can really help those in a more technical field work better with the clinicians and the business leaders that they're working with to help understand those populations and avoid using some terms that could potentially have a lasting effect on patients. For those of you that are training individuals in data science and technical programs, really think about how you're developing the business skills, the interpersonal skills, such as communication and critical thinking. For those of you that are training individuals in public policy and management and clinical programs, really think about how you're developing the more technical skills, such as data management, reporting, analysis, and modeling. This is really going to assist this PopHealth Troika to really be successful and really allow those team members to hit the ground running. Now we're going to spend a little bit of time, Suzanne, on the next slide, looking through different qualities of teams. And what's important to the PopHealth Troika is that you're almost creating or simulating an experience for that team that they're going to go through when they're in the real workforce. And these are what we call kind of soft skills that will really help them to advance and become leaders in their own right if they're individual contributors. And for leaders, it really helps them to strengthen the leadership across all of their teams and develop those individual contributors. So when in a learning zone environment, they have to really learn, it's beneficial if they can learn to build trust in one another, contribute to their respective knowledge, be heard, and listen to others. What is unique about the PopHealth Troika approach is the assigned roles and responsibilities are really unique to each team member. The analyst has a contribution, the clinician has a contribution, and the business leader has a contribution. Each of them must bring to the table a certain level of effort, support one another's ideas and workload, and be vulnerable when showing their lack of understanding or knowledge. They must demonstrate courage to disagree when warranted and identify when a conflict occurs and how to resolve that conflict. It is absolutely necessary to create these situations in a learning environment, as it will closely mimic what really happens in the real world of healthcare, particularly new fields like population health, where every person is really coming from their own unique training and experiences and knowledge base. And there's a lot of assumptions that are made about, or can be made in a misconstrued way about somebody's competency or somebody's ability or somebody's technical trade. And so you really want to come with a fresh idea and exhibit these more soft skills in your students so that they know when to recognize them and apply them in real world settings. So we covered kind of the team competencies aspect. Now I'm going to turn it over to Dr. Sylvia, who's going to walk us through how to educate and prepare executive leaders to lead population health and analytic initiatives at the organization or overall system level.
Thank you, Dr. Vigil. So think about, take you on a little bit of a different path here. Now let's think about educating executives for population health analytics. So many of the programs that you may be teaching in or running are meant to really develop leaders in healthcare organizations. And so one of the things that most leaders will be responsible for in some way or another is actually population health analytics and leadership. So a typical executive with oversight of data management in a healthcare organization needs to understand their organization's capabilities in population health. Executive programs can develop these leaders to systematically assess these capabilities within organizations. So this framework serves as a set of domains in which the assessment could be undertaken. So if we think about people, that includes what Dr. Behill was just talking about in the experience, knowledge, roles, and responsibilities. When we think about processes, we're talking about what is the team approach? How do people collaborate? How do they do project management? How do analytic teams work and work with other people in the organization? Culture includes things like workplace norms, strategies, perspectives, and the interpretation of key concepts. So think about the cultural differences of a nurse working within a technology company versus an informatics department in a healthcare delivery organization. Those organizational culture would be very different between those two organizations. Data tools and technology includes the software for data management, analysis, and visualization, and data contextualizers or groupers for making meaning out of data. Data infrastructure includes data availability and the ways in which it is organized and warehoused in an organization. Data governance includes the policies and procedures for managing data within an organization. And this includes data integrity and quality assurance methods, standardization and definitions, and stewardship of data. Analytic methods is where we get to the capabilities within an organization to perform various techniques with data that are specifically needed for population health analytics, which might include bivariate and multivariate statistics, epidemiologic surveillance methods, data visualization, and more. And PopHealth process analytic support includes all of those things that we were talking about earlier for the analytic products that support the population health process. And this is another aspect of being able to understand organizational capabilities for population health. Go to the next slide. So now we bring it all together. So we bring together the population health process and analytics. So think that is like heavy content along with the team development and the PopHealth Troika. So ideally, the population health process and analytics are occurring simultaneously and within the work of the interdisciplinary teams. So think about this scenario that happens frequently in healthcare organizations. Think about a risk-adjusted readmission rates are more than 3 standard deviations above the mean for an accountable care organization. And this is not an uncommon scenario. We run across it all the time. So a clinician, financial, or business leader is usually given the direction to lead the improvement of this performance, kind of as a blanket statement, maybe in an executive meeting. Often that leader will seek out data where they can find it. So they'll ask for the data related to the readmission rates. So often this is done in isolation without full context, and interventions are developed without full understanding, critical thinking, ethical considerations, or regard for clinical reasonableness and the patient's experience. Upon implementation using this type of methodology, these initiatives are often unsuccessful, having not been well thought out. So what we're proposing here, what I just explained to you was the pitfall and what we're trying to avoid and trying to help not happen for leaders and anyone working in this field going forward. So we're proposing this approach that's collaborative and interdisciplinary from the onset, and it facilitates and enables a challenge to be solved with thoughtfulness, rigor, and compassion. This slide is to point out that there are many core competencies in healthcare disciplines, and academic programs in these healthcare professions are developed through the mapping of curriculum and course objectives to these competencies in healthcare professions. And so why this is important is because what we're proposing here for the methodologies actually can link directly to these competencies. So some examples of competencies that do link. So if you think about QSEN, is quality and safety education for nurses. So within the domains of competencies in QSEN include teamwork and collaboration, patient-centered care, evidence-based practice, and informatics. If you look across other of these competencies, they include things like working in interdisciplinary teams, utilizing informatics, values and ethics for interprofessional practice, interprofessional teamwork and communication, caring for the health of populations. So all of what we're talking about here can be linked to these competencies and more. This is just what I've chosen to show on the screen. So I'm going to turn it over to Dr. Vigil to talk about the roles within the discipline of population health practicing.
So within those competencies, those translate directly into the job competencies for healthcare positions. And because this is going to be a workforce that's going to be in such high demand, and I don't mean just the workforce of clinicians, analysts, and business leaders, but the workforce of those folks that understand the basis of population health and value-based care. And every single one of the organizations that you see in this slide is looking for an analyst and a specialist job candidate that have been trained in population health and analytics specifically. The ability to track and trend and interpret data is as much a valued skill set as it is to banking and retail industries. Healthcare is just catching up. And so everything that you see here, health plans, hospitals, primary care, specialty care, are really looking and will select those candidates that are better versed in the healthcare transformation space and the concepts within population health and population health analytics that will give your students an edge when in the job market applying for jobs, because it is one of the skills that those hiring managers are looking for.
I'm going to talk a little bit about scaffolding competencies and capabilities into the curriculum. So we are talking about the textbook that has come out on population health analytics, and the way that we think about and design this for an academic program is that this work is designed to go across the leveling of objectives for curriculum. So if you think about the basic levels, we're talking about adopting population health conceptual models and frameworks. And then we can actually move on, if you want, and to understanding data sources. Before we really started this work, there really isn't a go-to guide to help people working in this field understand the details of the multitude of data sources that are available for population health used in practice today. And so that is really just part of the basic understanding that needs to happen. And then learning to contextualize data. So how do you take administrative claims data and other data sources in healthcare and actually make meaning out of it? So that's another part of the scaffolding. And then developing a population health data model. So now we have data, we have a conceptual model, we know how to contextualize it. Now we need to make it easy to use. And so now we learn how to develop a population health data model. And then we can design supporting data infrastructure around that data model. And then next, we would be actually now, after we have all that infrastructure in place, now we can understand the analytic methods that we need to have in place. That I was talking about earlier, like how do we adopt epidemiologic methods for population health from the purest sense of epidemiology? And I like to use this example of thinking about the prevalence pot. There's everybody who takes epidemiology knows the prevalence pot. So when we think about the prevalence pot for public health, we are looking at it a little bit differently than we are in population health. So in population health, we have attributed populations, and we have members who are enrolled in health plans. And so we have to think about coming in and out of that prevalence pot with regard to how people get attributed and how they enter and exit groups that are based really on managing value-based care for those populations. And then we actually take that scaffolding and say, how do we really synthesize this information and make it meaningful for decision-making in healthcare organizations? So you can see we start with a very basic infrastructure, and then we graduate and really take that to the pinnacle of being able to make meaning and make decision-making data.
So, I mean, I think what we've taken you through today is a lot. We have introduced a definition that didn't exist before. We have introduced a process that really is developed from a lot of the other disciplines, but spans across different disciplines, the way that the healthcare atmosphere and healthcare organizations work and act. We have outlined the skills that are required for analysts, clinicians, and business leads who are all working in healthcare today, the skills they will need in order to be effective in their workforce in the future. And we've also outlined a process for that team-based approach that can be taken at the educational level and at the teaching level to really train these folks to work in a more interactive and interdisciplinary way, in a way that mimics what the real world setting will require of them in their job settings. So with that, I think we'll conclude and we'll move forward to any questions that you might have. We're also very accessible and interested, provide our contact information to you as well, so that you can, if you have any questions or as you're mapping the competencies to your coursework, have any questions about how to do that or what to do or how it interrelates with the book or these concepts, please do reach out and let us know. So we'll open the gate for questions. Thank you, Suzanne.
That's great. Our first question is, could you describe again the key differences between population health and public health?
Yeah, I think I can take that one. And I think the point that I was trying to make, that it might not be so important to point out the differences as it might be to point out how they work together. So if we think about the problems that public health addresses, they're a little bit different than what we're addressing in population health and healthcare organizations. Population health strategies are usually driven from organizations that have a vested interest in meeting triple aim outcomes and driving understanding of population-based health determinants all the way down to the individual level to inform patient care and to inform programs and interventions that are going to be offered to individuals. One of the key differences that we talk about a lot is the difference between identifying individuals and delivering that care at the individual level versus not identifying individuals. And then Dr. Vigil, maybe you want to comment a little bit on that.
Yeah, I think when you're looking at the healthcare system today in its current state, that's still very much predominantly 95% a fee-for-service system. And what that means is people are still being treated and seen one patient at a time, uniquely. And those clinicians are required to kind of translate all of the evidence base that they've received in their training to that one person and tailor those treatments to the uniqueness of that one person. Very few opportunities are afforded to them to really think about populations at the 1,000, 10,000, million patient view. And so the marrying between the methodologies that are used in public health to really take a more systems and population health approach, how do we adapt those so they can be used more readily at a single clinical visit and empower things like decision support for clinicians so that they don't have to synthesize all of the clinical evidence base in their head from their training at the time of the visit, but it's at their fingertips. And it's done so through the data and analytics and technology platforms that we have today that support population health and value-based care. So really, in my mind, it's the marrying of the two that really make it so special, but they're also coming from very opposite ends of the spectrum in terms of how they operate today.
Where are there existing graduate programs in population health analytics is the next question. And I'm not sure if you can answer that or just share some of the graduate programs that you're aware of in population health analytics.
I think I'll start this, Dr. Sylvia, if you don't mind, because I've been hiring. My perspective is from the hiring side and hiring folks that are, I'm hoping trained in all of these different concepts, methodologies, and frameworks and technical skills. And I have been very challenged in my career to hire to all of the things that we're asking, be included in the training for population health analytics. What I think my experience has been, and to some degree Dr. Sylvia's, is we often hire these folks and then we train them while in the workforce on all of the concepts that we've described to you today. And one of our main motivations for writing the textbook was to kind of move more upstream in that and really propagate the learnings that we've had at the real world setting scenarios and move them upstream, those ideas and those best practices more upstream into the educational space. So actually one of the outcomes that I think I'm very interested in all of you is that there be more coursework in specifically population health analytics, because I think graduates of those types of courses and programs, I think will be highly sought after in the workforce. And I don't see very many today, if at all. I see combinations of different parts or pieces, and there are always kind of gaps that I've identified that we end up, rounding out during their work time with us. I don't know, Dr. Sylvia.
Yeah, I'll just add a little bit to that. In my experience teaching and then being on faculty at a couple of different universities now, I've had the opportunity to put together what usually is an elective course, or in a couple of cases, I have had the opportunity where I've been able to put together a course that was part of the core curriculum for a program for a Doctor of Health Sciences and for a master's level nursing program. So I have been able to put together a course as part of their core curriculum to meet some of these objectives and those competencies. But I have not seen a program. But I have been able to do a couple of courses and incorporate this material. So I am definitely excited to get some of these first programs going, specifically in population health analytics, but to bring this content to the programs that already exist that are helping people to be working in this space. I think this fits for both.
And if anyone in our audience is influential enough to kind of bring that forward, please don't hesitate to contact us, reach out to us.
Yeah.
We'd love to be able to collaborate on something like that.
Absolutely.
We do have another question here. How does population health address the quadruple aim of provider well-being that has become a glaring problem in the COVID era?
Mm-hmm. Yes, that sounds like someone who is keeping their finger on the pulse of what's happening to the workforce today as a result of the pandemic. So I applaud you for asking the question. I think it's brilliant. It's a struggle, and it is, if it's not, hasn't been already, it was part of, there are many organizations across the United States who have adopted that fourth arm of what's now called the quadruple aim. There's another version of the quadruple aim that also, for military families, names that fourth arm as readiness and readiness for deployment and readiness for battle. So just to be aware, there's two different definitions for quadruple aim. But what you're talking about in terms of clinician satisfaction and having enough clinical workforce in order to do the jobs of the future, there's a lot of attention being paid right now to clinical burnout as a result of the pandemic. And now more than ever, healthcare organizations are waking up to the idea that they cannot only live in a fee-for-service world and do things the way they have always done. So there's even more call to action of healthcare organizations today to transform their organizations into more value-based care. And for those of you that aren't as familiar with value-based care, it really is about achieving the outcomes. And one of those outcomes is clinical satisfaction, that there's enough of a clinical workforce in our future to provide the healthcare services that will be needed for all of the massive populations that we serve, knowing that it's a very limited workforce today. For now, there's just lots of signing bonuses going around for clinicians that are choosing to enter the workforce because they're so needed, particularly for those that can really participate in the transformational aspect. A great question. Thank you.
I'd like to add to that a little bit, and I would say that ideally, that if we are following these types of processes and we have in place interdisciplinary teams that are working through this process, then this becomes seamless on the clinician care delivery end, the ability to improve outcomes is seamless, and you don't have to think so much about it if it's happening within the systems that we work in every day at the point of care. So a good example of that is if working in a provider office, and a provider office gets a list of patients from maybe a health plan that says, you have 100 people whose diabetic A1Cs are out of control, and here's your 100 people, and you need to improve this for these 100 people. So they get a list, and they're left with the responsibility of being able to somehow implement something to make this better. In an ideal world, if we have interdisciplinary teams for working through the population health process, that happens seamlessly. No one at the point of care gets a list of people to work. We have this working in their clinical workflow systems, and we don't have them trying to manage 100 people at the same time they're managing one person. So ideally, if we can get this off the ground, it improves that fourth aim.
Great. We do have another question here about the level. On the website, you indicate this text targets graduate programs. Do you see any in an undergraduate program, especially those in business school? And this question comes from one of our best-selling authors, Sharon Bookbinder. So if you could...
Yes, yes, and yes. I've said this before. Dr. Sylvia has heard me say this before. There is so much room in healthcare for as many people as possible to be educated about these concepts, these frameworks, these processes. It's not even a competition. There's not even enough people for us to compete against each other with this knowledge. There's just so much more room for so many more people to join in, whether you're in business, a clinician, you're an administrator, you are a student, you're an analyst, you're an IT professional. If you're working in healthcare, these are the concepts and frameworks and ideas and methods that are really key to being able to transform our system into a more successful healthcare system in the United States. Yeah, thank you for the question. It is not. In fact, I am sending this to all of my former workforce colleagues. So it's not just for those that are training to be in a workforce. I'm recommending it to be for those that are in the existing workforce as well.
And I would just add to that, the textbook assumes in some of the writing, a basic level of understanding of some of the concepts. And so what we are really trying to do is take those concepts to another level where we're applying them specifically to needs of healthcare analytic needs in the field. So sometimes when you think about an undergrad program, it might be at the later on in their program where they've had some of the basic skills, like a statistics class or classes like maybe that help them understand quality improvement or things like that. So they have a little bit more context about healthcare delivery before we start applying the concepts.
Trying to see if there's anything else here. I think that might be about it. There's some thank yous.
Yeah, I think we can probably put up our contact information maybe for those folks that I know they're going to get this webinar after the fact, but if you want to contact us as well.
Yes.
Happy to answer any follow-up questions that may arise.
Perfect. Just a quick note, this is the book that we're talking about, their recently published book on population health analytics, which is essentially a how-to guide for achieving population health analytics. You see the book on the screen. It comes with ebook access, and it can also be purchased as a standalone ebook. And if you'd like to learn more about the text or request a review copy, please visit go.jblearning.sylvia for more information there. And as Enos just said, here is the contact information for both Dr. Sylvia and Vigil here up on the screen if you want to reach out and contact them as well. On behalf of Jones and Bartlett Learning and all of you, I want to personally thank Dr. Sylvia and Dr. Vigil for this insightful presentation today. I hope you learned a lot. I know I certainly did, and I hope it inspired your thinking about population health analytics. If you have any questions about today's webinar, please don't hesitate to contact me at Suzanne Walker at swalker@jblearning.com. Thank you for your time today, and this ends today's webinar.